Today, we'll learn how to perform MRI of the lumbar spine. This scan is one of the most important MRI studies when a patient has low back pain, disc prolapse, or suspected nerve compression. In this video, I'll show you step-by-step how to position the patient correctly, how to plan the sagittal and axial planes, and which sequences are used, such as T1, T2, and STIR. By the end of this video, you'll clearly understand how to perform a perfect lumbar spine MRI on a SIEMENS 1.5T or 3T machine.
T2 and T1 TSE sagittal. Plan the sagittal slices on the coronal plane and angle the position block parallel to the spinal cord. Check the positioning block in the other two planes, ensuring an appropriate angle is given in the axial plane, parallel to the center of the vertebral body and the spinous process. Verify the position block in the sagittal plane, ensuring the field of view, FOV, is big enough to cover the entire lumbar and sacral spine from T11 down to the coccyx, normally 350 millimeters. T2 TSE axial multi-block and multi-angle. Plan the axial blocks on the sagittal plane. Angle the first position block parallel to the L5-S1 intervertebral disc, the second position block parallel to the L4-L5 intervertebral disc, and the third position block parallel to the L3-L4 intervertebral disc. Only 3 blocks are needed in a normal spine. Additional blocks must be taken in the presence of a prolapsed disc in any other levels. An appropriate angle must be given in the coronal plane parallel to the intervertebral disc space. Slices must be sufficient to cover the intervertebral discs, normally 5 slices for each disc space. A saturation band must be placed over the abdomen in front of the aorta in the sagittal plane. This is to avoid peristalsis and breathing artifacts over the spinal area. To prevent crosstalk artifacts, ensure that the blocks are not overlapping in the area of interest, particularly the spinal canal.
T2 TSE coronal slices. Plan the coronal slices on the sagittal plane. Angle the positioning block parallel to the psoas. Check the positioning block in the other two planes. An appropriate angle must be given in the axial plane across the right and left psoas. Slices must be sufficient to cover the whole psoas from anterior to posterior. The FOV must be big enough to cover the whole psoas, normally 400 to 450 millimeters, from T12 down to the lesser trochanter of the femur. Adding saturation bands in front of the coronal block will reduce artifacts from arterial pulsation and breathing.
Indications for lumbosacral spine MRI. Localized back pain and radiculopathy with 6-week course of conservative care and inadequate response to treatment. Infectious or inflammatory processes, e.g., spinal cord abscess or spinal osteomyelitis. Myelopathies, multiple sclerosis and other demyelinating diseases. Possible spinal cord injury and post-traumatic neurologic deficit. Cauda equina syndrome, e.g., sudden bowel bladder disturbance. Evaluation or monitoring of congenital malformations of the spinal cord. Evaluation or monitoring of inflammation of the CNS or meninges. Evaluation or monitoring of tumor of the CNS or meninges. Investigation of any cause of spinal disease in pregnancy. Evaluation or monitoring of spinal cord compression.